Over the past many years, there's been a growing recognition that people of different abilities require different supports. We've covered some of that through the lens of the Accessibility for Ontarians with Disabilities Act. Tonight, we're going to talk about the challenges faced by those with intellectual and developmental disabilities, who often require lifelong support of family and other caregivers. So, let's welcome Chris Beasley. He is Chief Executive Officer and Board Secretary of Community Living Ontario. Martikwa Lamkin, Registered Social Worker and Disability Lead at Become Resilient Individuals Counseling Services. She's also a professor at George Brown College. And Sherry Caldwell, co-founder and director of the Ontario Disability Coalition. And it's great to have you three with us here for this discussion tonight here on TVO. Sherry, to you first. How do developmental and intellectual disabilities, generally speaking, present themselves?
Developmental disabilities are very diverse. My daughter was born and immediately needed lots of care. They can have physical disabilities, intellectual, behavioral, social. It's very diverse. They usually present in childhood.
Well, let's talk about your daughter, Ashley, right?
Yeah.
Okay. How old is she now?
Ashley just turned 18.
18. So describe her for us.
So Ashley is a sweet, bright young lady. She needs a wheelchair. She has a physical disability and a walker to get around. She communicates with AAC. She also
she communicates with
augmentative communication.
Oh, okay.
So she uses an iPad to communicate. Communication is challenging. She needs help with daily living and even has a G-tube for feeding. So she requires a lot of support to function in the world. She loves high school, but it's a very shortened day. There's a lot of support needed, and unfortunately not enough out there. Okay.
Marty, what are some of the incorrect assumptions that people living with developmental disabilities have to face in Ontario?
Yeah, there's several of them, and those biases and attitudinal perceptions come from, ableism. So this idea that they're incapable, right? This idea that they're inferior, this idea that they're even kind of just less worthy of their own dignity and their own rights. And so we see that idea that therefore we need a cure or a helping professional to come in and to help these people because they're not able to kind of function. So it's some of those ideologies that we see in the way we deliver our services and our care. And really, we want to work from a strengths-based perspective, which means that everybody has challenges in life, everybody has strengths in lives, and we want to highlight those strengths as opposed to working from a deficit model. What's wrong with this person or what's their limitations? So.
I totally appreciate where you're coming from on that, but the reality is these are people who need more help. Isn't that fair to say?
Of course, but that help should not be what kind of labels or stereotypes them in a specific way, because we all do need help in different ways. That's just part of the human condition, right? So yes, there are going to be individuals who require additional support, but we should not stigmatize or label them because of that and treat them differently because of that.
Gotcha. Chris, Ontario's ombudsman recently launched an investigation into cases with people with developmental disabilities who are stuck in hospitals. How do families in distress end up in this situation?
Well, I think you said the word distress. I think that's the key point here, where you have families who are in crisis, who are in distress, and you will take any port in a storm, and so people will be placed in a hospital, and hospital is it's people who are ill, not simply because you have a developmental or intellectual disability, and yet they end up languishing there for months and sometimes even years, and then sometimes transferred to a long-term care facility. So we know of people in their 20s, 30s, 40s who are in nursing homes.
And should not be there?
And should not be there. They're there for the only reason that there's a lack of capacity and a lack of our will to support them as a society.
Marty, the ombudsman also said that vulnerable people are, quote, often kept in restraints and their condition deteriorates. Yes. Okay, what are they doing in a hospital in the first place under restraint if that's not the place where they ought to be?
So it's very common that medications are going to be used to sedate folks, right? So again, you're out of your typical environment, whether they're used to their homes or their day programs. You're in a hospital setting. You know, during the pandemic, again, it was very difficult for parents to interact with their families. So that was a huge challenge. And so it's not uncommon that medications are used to kind of sedate patients, to make them sleep, to make them feel drowsy, because again, the hospital is not an appropriate place for them to be residing in. It's in a kind of an acute care, healthcare setting, right?
And even for any of us on our best day, we're probably anxious if we find ourselves in a hospital environment and don't know when we're going to leave and don't know what's going to happen next, and maybe can't communicate with the people who are around us. And you know, all due respect to the medical profession, they're doing the best they can. But when faced with situations where they're not properly qualified to support people, then you know, what could possibly go wrong, right? And when you talk about medication or behaviors, as they're often talked about, it's people are trying to communicate. They're trying to let their wills and preference be known in an environment where they have no control, they have no power, they have no options. So of course there's going to, you know, could be behaviors, and then you see restraints, and it's it's a vicious circle.
Sherry, you wanted to say?
I feel like we have to think of why they're ending up in the hospital in the first place. It's because of lack of home care and supports in the home, or supportive housing, or group homes, or financial support to go into day programs, or support to participate in the community. There's a bit of an institutionalized mindset within the government that people, even you see it for seniors, building so many long-term care homes, but people with adults with disabilities, even seniors, want to be at home and in their communities, but we need support to do that.
And there's not enough home care.
No, there's not enough.
Not enough. Well, okay, can we use Ashley as an example here? Okay, you've mentioned that Ashley needs a wheelchair to get around. Do you get, I mean, what support do you get from the people of Ontario to help with Ashley's care?
Ashley has nursing care that visits her at school, and she has a little bit of nursing and PSW at home. She's lucky. I'm well equipped to advocate on her behalf. But many families aren't so skilled in navigating the system, and also families that need more care or just in different regions don't have access. So they're not funding nurses enough, or nurse wages in the public sector. The raises, they have to give them a raise. They need wage parity, because nurses are leaving for higher salaries at hospitals, at long-term care homes.
How much does a wheelchair cost?
My daughter actually just got a new one, and it was over $8,000.
Did you get some help with that?
We had help through Easter Seals, but parents under 18 have to fund 25% of your child's wheelchair. Or any assistive devices, and then if you can look to Easter Seals for that. But they're having trouble even to keep up with all of that need.
But Easter Seals, that's a private organization, right?
It's a charity.
Yeah. So the Ministry of Community and Social Services does not help out with this?
They help out 75%, but they expect families. If you're really have a lower income below $70,000, then they'll give you another program called Assistance for Children with Severe Disabilities.
And what if you're past 18 then?
And past 18, they actually do 100% fund. They're not leaning on the families for the equipment as much, but it's limited the number of the equipment that they will cover. So they'll cover wheelchairs, they'll cover walkers. They won't cover ramps into your home. They won't cover a special seat for the toilet, a bath chair. There's many, many things that are not covered under the assistive device program.
Well, Chris, let's talk money here. Essentially, how does the current funding model work in the province of Ontario, whereby if you need some help, here's what the province can do for you?
Right. So first they'll look at your condition, if we can say, your disability. They'll assess if you're qualified, and then if you do qualify for support, then they assess the level of support that you will need. And once they have an idea of what that looks like, then currently it goes into this black hole of a priority list where only the most needy will come to the top of that list. So in essence, we operate in crisis mode all the time. So if you do have a stable home environment and you're lucky enough to have parents and a roof over your head, then you're not likely to get to the top of that list anytime soon. And that's talking about more sort of residential support. Where do you want to live and how do you want to live? They're working on, a funding formula now that says, how much will each person get and what is the sort of the funding entity that will look at that. But that's still a few years away. And so we don't actually know right now how the funding actually gets arrived at.
Are people, again, I don't know if condition is the right word, but help me with the vocabulary here. When I describe people who have, do you say a condition?
I say folks who are living with intellectual disabilities, developmental disabilities.
Perfect.
Yeah.
Are they eligible for Ontario disability support programs?
They are, but again, that also is quite limited, right? So there's kind of a shelter component, a basic needs component, and it's quite limited in what you can access. So again, it's not the only resolution. Oh, great, we have Ontario Disability Supports, ODSP, that's it. No, as Sherry was stating, there really needs to be an accumulation of supports to really wrap around families.
Would a guaranteed annual income, or a basic income, as it was once called, how would that change this?
I still don't think it would be enough. The dollar amount is not what we're just only talking about in terms of somebody's fullness to participate in their communities, right, and their wellness. So we really have to look at kind of community participation supports, what programs are available, how to remove barriers and access to care, and also how do we disseminate the information. As a registered social worker, a lot of my role has been working with families who simply just don't know. The information is very complex. The information is not very clear at all. And I've also worked with parents who have developmental disabilities themselves. So I've also worked with several mothers. I've done a lot of advocacy through, Child Welfare Society, things like that, where the parent themselves has an intellectual disability.
The parent and the child?
Exactly.
Yikes, how do they deal with all that?
So there, again, and you need a lot of wraparound support. So when you're receiving, intake documentations to even apply for ODSP, for example, I really have to break that down. I have to use visuals. I have to kind of recreate some of that documentation to adapt it to meet the needs of the parents. And that's another area also that isn't really looked at or considered.
Sherry, forgive the simplistic way I'm going to ask this question, but if you have more intellectual disabilities, or if you have more physical disabilities, do you get more money from the government?
No, unfortunately not. With the passport program, they will assess you and give you a bit more money, but it's not enough to meet the needs. And then if, like for instance, if my daughter needed to go to a day program and participate, and they're going to charge her more. So if you don't need, if you need one-to-one support, it could cost triple the amount. So it's just insufficient. And right now they're putting families on $5,500 a year. So when you finish school and you're 21, that'll give you 2 hours of care a week. So families, if you're lucky to be able to go to work before your child finishes school, you're going to have to leave work as soon as they graduate. And we know in Ontario with inflation and the cost of living, parents can't. People need income, they need food on the table. Families are in crisis.
Okay, again, I don't know if this is the best way to ask the question, but do you, Marty, do you need more or do you need a revolution here? In other words, more of the existing, or is the existing just not the right way to approach this and we should start a revolution and start from scratch? What do we do?
Yeah, I think that's such a great question. I'm all about revolutionist kind of mentalities and ideas. I think the landscape has changed. I think people's needs have changed. Our society has changed. So I really think we need to start with families. We need to start with the individuals. As much as I'm really privileged to be on this space, I do not identify with an intellectual disability. So I recognize the privilege I'm even taking up to talk on this topic. But we really need to hear directly from the families what they're experiencing, what their lived realities are like. And the proof is kind of out there. Families are telling us, I need A, B, C, and D. The challenge is the government is not responding.
What's A, B, C, and D? What does that constitute?
Funding, additional supports, culturally appropriate support. So a huge part of my advocacy is around how anti-Black racism is also a part of the developmental service sector and how Black families, for instance, when Sherry is talking about the importance of advocacy, when sometimes Black families are advocating, that is seen as them being aggressive. angry, disruptive. And so we get stereotyped in particular ways that create additional barriers to accessing services.
Actually, before we started this discussion, you were telling me how if you're a black teenager who's autistic and you're walking down the street with a hoodie on,
exactly.
what?
Right? Who's that dangerous person, or who's that, mysterious person in my neighborhood? And I've developed a program called Racism Affects Me Too to work with adults with intellectual disabilities to teach them about anti-Black racism, because I found that there wasn't anybody really doing that work, especially following the death and the murder of George Floyd, where I had Black folks on the spectrum saying, Marty, could that happen to me? Could that be me? And so, again, they are going to be seen as Black youth and under those kind of racial stereotypes before they are seen as having an intellectual disability.
Chris, do we need a revolution?
I think that it's tempting, because obviously we need a lot of wholesale change, but I also worry about people and families who currently rely on supports, because some do get what they need or are happy with the supports, and so you don't want to pull the rug out from under them, which a revolution could do. So I think, the government right now has an initiative called Journey to Belonging, and it's going to run through this decade. And it's looking at transforming how services and supports are delivered, and more person-centered, person-directed, more direct and individualized funding.
Is the right approach to take, in your view?
I think it is, yeah. I think it says all the right things. Obviously, the proof is in the pudding. As we move down that track and as it gets implemented, then we'll see. But I think it's a good framework from which to start.
Journey to belonging.
Right.
Where do you want to see that end up?
So I would like to see it, again, as Marty points out, it has to start with the person, has to start with whoever's around them, whether that's family, friends, neighbors, community. How are they supported? And then how do we provide those supports in a way that's appropriate in terms of the need and the amount? And then for people to live typical lives in their community. How might we, imagine that, and how can we create a vision for each person to live their best life with the right amount of support that each person requires? Because everybody's different. Everybody at this table is different. Everybody who has a disability is different.
16 million Ontarians? How many people do you think we're talking about here trying to help?
How many people have an intellectual disability in Ontario? We estimate about 100,000 that specifically identify as having an intellectual disability. It's possible. We can do it. We just need the will.
Yeah, as a percentage of the population, it's actually not that much.
Exactly.
Right. Do we need a revolution here, Sherry?
I feel we need big change, in that Ontario is way behind. When you look to other countries, like in Australia, they started their national disability insurance strategy in 2010. And there are ways into it, and it's really improved the lives for people with disabilities.
How so?
They have more control over their funding, over their supports. They have a direct funded model that puts the power back into the people with disabilities and their families to get the resources they need. So some people there have access to accessible vehicles. Right now, families here, it's unaffordable to purchase a new van and then to add another $30,000 to make it accessible so that you could actually get out of your home and participate in the community. But it also helps them hire workers. It gives them more control. And right now, families are just falling into these gigantic cracks in the system.
Can I ask you about Ashley? When you want to take Ashley out for something, and she needs a wheelchair to get around,
Yep.
how do you travel with her?
Well, we're lucky. We have a van. We can put the wheelchair in the car and take her out, but that's a privilege that we have. It's just not affordable for many people with physical disabilities to afford a van. My daughter's school is having a track meet, and there's not enough buses for all the kids to get to the track meet. So I'm able to take her there, but some of the other kids in the class aren't going, right? So the school's going to adapt. They're going to do something for them there. But these kids need, the province needs to help support families in many, many ways. Programs and nurses, cars. I could go on, but it's just a vast, people are just suffering because of it, and these kids can't participate in the community, these adults either.
Right. OPSU, the Ontario Public Servants Employees Union, is the union, I guess, involved in a lot of the work that all of you do. This is from a report that the union submitted to the provincial government back in 2021 related to some of the issues that we've been talking about here. And Mr. Director, Sheldon, would you bring this up, please? And I'll read along for those listening on podcast. The agency service model has been the backbone of community services provision for individuals with developmental disabilities. It must remain the central vehicle to service delivery to ensure that all individuals have access to quality services, even when they are not the immediate choice of some families under the direct funding model. Okay, you're going to forgive me, OPSU, for putting it this way, but that's very bureaucratese speak, and I need to know what that means. Professor, you want to tell me what any of that means?
Again, yeah. So I think there's a bit of different views on what the best way forward is. There are some who believe that particular agencies should receive the funding, and those agencies then hire folks like myself that work within those agencies to deliver the services to the community. And then there are other folks who are saying, well, those traditional services may not meet my child's needs exactly. If you're thinking of a sole care provider, for example, and they're working 9 to 5, well, I work only 9 to 5, so I won't be able to provide them with that support, right? So then there are folks who are saying we want to actually have funding so we can use it in ways that are actually relevant to the care needs of our lives. I think Sherry has spoken to that quite a bit. And so I think there needs to be kind of a balance between those two perspectives.
Chris, you want to weigh in on that?
Yeah, I mean, I take exception to that statement. Certainly the first part in terms of agencies having been and continue to be the backbone of supports and services in this sector. But unions have as their central role representing their members. And I think that last part of the statement where it says even if families don't want agency supports or the supports through an agency, that's too bad. And I think it doesn't even mention the people being supported. And I just think it trivializes the people whose lives are at stake here and who rely on that kind of support. And it doesn't address their needs at all. So there's plenty of people who are parts of various unions who are very well qualified and do excellent work and provide wonderful supports. And there are others who aren't, who also provide those supports. And I think people, and specifically people who have disabilities, need the opportunity to hire the people that they want to have support them, that they know may be culturally relevant, who have the same holidays, who have the same meal preferences, who relate to, in a culturally appropriate way. But if they're working through an agency, they probably don't have that choice. So I just think that we need to move more to an individualized approach, and that statement doesn't seem to support that.
Sherry, what did you infer from the statement?
I feel the backbone of supporting people with intellectual disabilities oftentimes is families and oftentimes is mothers. And these people need support too, and they need a bit more transparency and flexibility with the funding. So I think giving families the direct funding is important. And the funding will go back into the community. They will hire, they want care, they want, we don't want adult children sitting at home. We want them out, we want them having meaningful lives, and that's what they want to do too.
All right, Marty, let me ask in our last couple of minutes here the tough question, which is everybody's coming at government for something, right? Everybody wants government to do more. They want taxes frozen, and they want more services, right? I mean, it's almost an impossibility. So how would you make the case that the group of people you're representing here today deserve their slice of the pie?
I think it's just around really basic humanity, right? It really is that simple. Compassion and humanity. These individuals should not be forced into neglectful situations, which is kind of the conditions that they're living in. Their needs are not met in many different ways, and so I think it's really about challenging ableism and ableist views and really working to break down those. It's not just about building a ramp so that people can get into a building. It's about the idea that we continue to function in society that continues to devalue folks with disabilities and intellectual disabilities. So there's that huge attitudinal barrier that needs to be challenged. And when we can challenge that, then we can build capacity for understanding why these needs are important.
Well said. That's Martiqua Lampkin. But we call her Marty. That's okay. George Brown College, Chris Beasley from Community Living Ontario, Sherry Caldwell, Ontario Disability Coalition. Really good of all three of you to join us here on TVO tonight. Thanks so much.
Thank you so much.
Thanks very much.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.